What kind of lasers do you use to remove a tattoo?
Typically for tattoos, the laser that's used is a picosecond ND-YAG, neodymium uridium aluminum garnet laser. When you get a tattoo, your body's trying to destroy it every single day, but the ink particles are so large that they're conglomerated in this dermal layer of the skin, so your body just kind of ignores them. And so it just sort of leaves them alone. Now, why do tattoos fade over time? Because your body is sending white blood cells and occasionally breaking down that ink a little bit. And all we do is augment that process. So laser light enters the skin and it fragments these large metaphorical boulders. And these boulders, we break them down into stones. And your body washes a little bit away. And the next treatment, we break those stones down into pebbles, into dust, and eventually your body washes it away. So your body is doing the job. Your body is metabolizing it. But we're simply teaching your body to attack these smaller particles, and they can obviously do a much better job destroying smaller particles than larger particles.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts.
We are back, Selah.
We are
What's
back.
up?
Hello. Good to see you.
It's good to see you too.
Today, I'm so excited to talk about laser hair removal.
Really?
Well, yes, because
Why?
I want it.
Oh, you want laser hair removal? Well, what about,
Yes.
we're also going to talk about laser tattoo removal.
Exactly.
So I'm excited to talk to our expert today, Dr. Will
Mhm.
Kirby, because he's going to tell us all about laser hair removal, laser tattoo removal.
Dr. Will Kirby.
Yeah.
Yes, he's coming in.
Yeah, he has a biology degree from Emory University and a medical degree from Nova Southeastern University.
Yes, he was selected to serve as the chief resident in the Department of Dermatology at Western University Pacific Hospital.
He's also a published author, a lecturer, and an advisory board member for dermatological publications. That is a mouthful.
That is a lot of things on his resume. And
Mhm.
beyond that, he has been on more than 35 different television programs.
Like, oh, wait, you know what? Full disclosure.
Okay.
When I was doing my research to prepare for this episode, I kept looking at his picture like, wait a minute, he looks so familiar. That is not the same guy from Big Brother. It is the
No.
reality show Big Brother. Not only was he on Big Brother, I mean, this is a long time ago, he won.
Wait, really?
He's got a lot of talents. He's
That's
a dermatologist. He's been on all
amazing.
these TV shows.
Was that like, what season was that?
The first season?
What?
Very talented.
Wow.
Yeah.
I
Yeah.
can't-
And now he's a doctor. Well, he was a doctor
I mean,
then
just,
too.
like, on the
but,
side.
yeah, just on the side. Just on the side, right?
Little thing.
And
Wow.
Dr. Kirby is a dermatologist and chief medical officer at Laserway.
Okay, Laserway. I've seen them everywhere.
Me too.
I want to know what
like
this
all
is
over
about.
the country.
Yeah, like tell us all about Laserway. What is it besides lasers?
I mean, it
helping things
sounds
go away?
obvious, but
Yeah.
also like, what do you do there?
Yeah,
at
what exactly
Laserway?
do the lasers take away?
Besides just the tattoos and the hair.
Right. So we're gonna find out.
Let's bring in Dr. Will Kirby.
Yes.
Welcome, Dr. Kirby.
Thank you so much. I
Oh.
appreciate it. I really appreciate it, and I'm so happy to be here.
So good to see you. Thank
We're
you
talking
for
about
being
laser
here.
hair removal today.
You're
Yes.
excited about it.
Can
I can
you
tell,
tell?
Melissa.
Laser,
Yeah.
everything off.
Who knew? Who knew that would be so exciting to talk about? Because here's the thing. I think as you get older and become just more aware of like what you like and what looks good and what feels good, you decide what you want to get rid of and what you want to upkeep and all that.
Mhm.
And for me, as a 40-something mom of one, I hate shaving.
Ugh,
Is that
the
is that
worst.
it's so because it's just another
and also
thing, another
waxing
chore.
and sugaring
Shaving,
and all of
sugaring,
this
Depilatory
stuff.
waxing,
creams and
depilatory
everything.
creams, all of it. And
All of
laser
it.
hair removal can, get rid of all of that.
I don't want to dive right into money, but there's a value proposition as well, which is the cost of, razors and shaving cream over your lifetime, not to mention the time. Well,
Yeah.
if you start at someone who's
Time.
18 and then go through your lifetime, it's actually less expensive to get laser hair removal than it is to do all these other things.
I believe it.
I believe that quick
Absolutely.
math. I believe
Yeah.
it. Yeah.
And not to mention, again, the time. I mean, how much time will you save?
Well, and just
That's
going
the
back
main component.
a little bit, you're a very well-known on TV doctor, a
Thank you.
dermatologist.
A
Yes,
little bit.
you've been on TV a few times, very many reality shows, Dr. 90210.
Mhm.
So you've been around the block as a dermatologist. What would you say, what's your favorite laser treatment?
Oh, wow. I don't even know if I could answer that. I mean, I would say most popular for someone who's never had anything is laser hair removal.
Okay.
So if you're new to the market or, concerned about the industry, well, that is the single best thing you can do because it just works so well for the right candidate.
I feel like a lot of people are skeptical of it because when you hear the word laser and it coming into contact with your body, you're thinking, oh, that's painful. I'd rather just do what I know that's not.
This is a great segue. Any rumors that laser hair removal isn't effective, they're not true, but they exist. And why do they exist? Well, they exist probably because the technology has really changed a lot in the last 15 years, and they probably were treated previously. And the older technology, it was more painful, it was much less effective, and it just wasn't as safe. So newer technologies have arisen, as is always the case with technologies, they evolve. So it's much, much better these days than it was previously. And the other thing, there's a psychological element to this too. Laser hair removal requires 6 to 8 treatments to get a great clinical outcome. And many people who haven't committed to that entire process aren't going to get those good results.
Yep.
So people will
That was
say,
me.
it just didn't work as that well. It didn't work for me. And it's like, well, how many treatments did you get? 4. Well, then
Yeah.
you didn't fulfill the whole package. And it's important
yeah.
to get all those treatments. So with each laser hair removal session, you're going to be removing 10 to 15% of that existing hair. So
Okay.
if you get 3 sessions, it's not quite, you're going to get like 30%, but you can't even tell a reduction unless you lose 20%. So with the human mind can start to notice a reduction at that number around 20%. So
Oh.
you were probably at the part where you were starting to see results. And the mistake you made, no offense at all, is you just didn't
I didn't
continue
keep
with the
going.
process.
I wish they would have said something.
It's a function of education. Like
Yeah.
there's a lot of fibbers in this industry. So people will say, "Hey, my neighbor got 2 treatments and has 0 hair."
Oh, that's
And
my
I say, I'm not
favorite.
going to call her a liar, but she might be fibbing because
Exaggerating.
the
Oh,
medical
less than
literature and the
candid.
experience are that you have to have 6 to 8 treatments.
When it comes to deciding whether or not someone is a good candidate for laser hair removal, what are the characteristics of someone who is a good candidate?
So the most important factor is the color of the hair and the density of the hair. So when you talk about the MOA, mechanism of action of laser hair removal, it's really fascinating to me. You have to have a chromophore. The chromophore is melanin. And that chromophore is embedded deep into the hair bulb, and there are stem cells that live at the bottom of that chromophore. So you're actually trying to destroy the stem cells. Now, how do you access them? Well, the laser light, the energy goes through the remaining hair shaft that's been shaved. It goes down there, hits that bulb, destroys the bulb and the stem cells. So this is why if you wax and you rip the hair out, you could pull it all the way out and you could see the hair bulb, but you didn't get the stem cells. And if you shave, well, you're nowhere close. Depilatory cream, nowhere close.
Oh.
Sugaring and threading, you might pull the hair out, but again, you're not getting the stem cells. So to answer your question, I didn't do a great job answering your question. To answer the question, that dark, dense hair bulb is directly above those stem cells, and that's our target.
Okay.
Oh, wow.
And so if someone has like blonde hair, gray hair, really light hair, they may not be.
Some people with lighter hair are not going to be the best
Okay.
candidates. Okay,
Okay.
so
Okay.
silver hair, it doesn't work on. Blonde hair, red hair, it won't work.
Wow.
But anyone who has dark brown, black hair, it'll work very, very well.
And you said 6 to 8 treatments. Is that on average or is that
I
everybody?
love this question. 6 to 8 treatments is a very general average.
Okay.
Depending on your national origin, your genetics, where you are in your life, you may have more hormones, androgens specifically, and that can cause hair growth. So let's drill in here. Prior to puberty, no one's going to grow hair, right? Because it's the hormones during puberty that cause maturation and cause hair to present. After the climacteric period in women, 50.5 years of age, when you start to go into menopause and those hormones decline, you're not going to grow hair then. But you referenced having kids during pregnancy, breastfeeding, birth control, oral contraceptions, anything that can alter your hormonal status can change your hair growth. So you can have laser hair removal and have complete 100% removal of the hair and then get pregnant and have some hair regrowth. Or, change any of these things if you start working out like crazy and women produce a little bit of testosterone and you get stronger, and you're really fit, you can get some hair growth. So these different factors can affect the hair growth, and that will ultimately affect how many treatments you need. But in general, 6 to 8 treatments will give you typically an 85% reduction at least, with the caveat that, again, some cultures are hairier than others. Some people need more hair than others. Very, very transparently, with Japanese patients who have black hair and it's straight, they do really, really well, and they skew on the side that might need 6 treatments. Some people who are Indian American and they have, curlier hair, dense hair, but more hair, well, they might skew more toward the 8 treatment number.
And
Interesting.
the other thing that I want to talk about is the timeline. Okay, so you say
Yes.
6 to 8 treatments, possibly more, just depending
Right.
on your, I guess, country of origin, genetics, all those other factors. Is it also like I'm coming in right before prom and I'm like, oh, I want to make sure I have no hairy armpits before prom? I should have started 6 months ago,
Melissa,
or
when's the best time to plant a tree? The answer is 20 years ago. When's the second?
oh,
When's the second best time to plant a tree? Is like right now. So we can only
okay,
control things today. You
okay,
know what I mean?
okay,
So I tell people look, prom's coming up in 2 weeks. There's not a lot we can do.
okay,
You
okay,
get one
sure.
treatment, it's not going to do much. But so you need to, yes, plan effectively, plan in advance, and different parts of the body have a different androgen phase of growth.
Okay.
So there's multiple phases of hair growth, and you have to hit the hair in a very specific growth phase.
Okay.
And so
It's
on
complicated,
it
Dr.
is
Kirby.
but
That's why
see,
you have
That's
to
why
have
he's a
an-
doctor.
That's why he's a doctor.
well, it is complicated, and again, it's an educational quotient is when people do best. So
Okay.
people say, which laser is best? Well, the technology is gold standard. Of course, we use the best devices,
Right.
but there's a lot of devices out there, and it's not so much the device. Yes, you have to meet that standard, but it's more a function of educating the patient about when they're going to need to come in and encouraging them to purchase the package so that they get the entire
Mhm.
treatment with the right timeline. As an example, on the face, generally speaking, we want to treat about every 4 weeks because the hair and the sideburns in the face grows a little faster.
Okay, I was gonna say, can you talk about laser hair removal on the face
Yeah.
and neck? What is that about?
Well, on the women will as you are exposed to androgens over your lifetime, women are going to get a few, don't kill the messenger, billy goat gruff
Ugh,
whiskers,
that's
right?
everyone?
Or
It is
it's pretty common. And then, but in the sideburns,
Not
a
ready.
lot of
No,
times
not
women
ready.
will they'll have hirsutism and grow a little hair on the face.
Really?
So needless to say, and the neck too, back of the neck. So that area grows faster, and as a result, we want to treat in a shorter time period.
Oh,
That's
right.
about every 4 weeks. Sometimes it's every 3 weeks. It really depends on that regrowth.
Okay.
And of course, we'll monitor that and assist. But on the body, it's about every 6 weeks. Might be 5 weeks, but they're just different timelines. So it's a function of explaining that because sometimes people come in and they say, Dr. Kirby, I'm getting, I want a little bit of hair removal on my sideburns and I want bikini. Great, but we treat those at different timelines. So we have to
Times,
coordinate it appropriately, or you're just
yeah.
not going to get the best result.
Of course.
Nothing bad will happen, but you'll
Sure.
need more treatments.
Oh,
It's
okay.
very scientific.
It is.
But that's good. That's a good thing.
You want to
yeah,
be, yeah,
absolutely.
Is this the same for when men get a laser hair removal on the neck?
Yes, so
Okay.
I really like men. I got it myself. I'm not a hypocrite at all to get laser hair removal when my hair was darker at the bottom of their neck. So with men, the growth pattern is the grain, so to speak, is downward for most of the beard, but at the bottom of the neck, it's upward. And that often
Oh.
causes ingrown hairs. And
Right.
look
Not
at the men in your life, and you can, if they haven't shaved for a few days, you can see a very clear line of demarcation where
Yeah.
the hair above is growing this direction.
Down,
And so you draw a line there, remove the hair below, and then when they don't shave, they just look very well groomed.
Wow.
Look at us.
Back
Getting
of the neck,
educated by
too.
Dr.
Would love
Kirby.
this.
Back of the neck for men is another great area for hair removal. It won't work on the scalp because I love this little nerdy question when I'm training residents. Scalp hair, there's 3 phases of growth: anagen, catagen, telogen.
Okay.
Anagen's the growing phase. That's where you have to hit the hair. That's where the treatment matters. Catagen and telogen don't matter as much. Catagen's sort of a transition phase. Telogen is a falling out phase. But the hair on the scalp, that anagen phase is about 6 years. So that's why your hair can grow really far on your scalp, right? Why can your arm hair not grow very long?
Right.
I don't know.
Because it stops growing after about 6 weeks. So if you try to do laser hair removal on the scalp for men who are kind of bald and want to remove the rest,
Oh.
it just won't work
Wait.
because, well, it would work. You'd have to treat every 6 years.
Oh, geez.
And you need 6 to 8 treatments. So you'd have to treat 36 to 48 years. So needless to
Oh
say,
my gosh.
scalp hair removal is a terrible idea. But the body and the face, It works really well.
Okay.
And so we talk about the back of the neck. The back of the neck doesn't have that 6-year growth anagen phase. That hair can only get about 2 inches.
Wow, that's so interesting.
Let's transition to lower on the body, Dr.
Yeah.
Kirby.
So this is
That's
where
when I
things,
did it, the laser bikini.
we'll go PG-13
Okay.
instead
Sure.
of PG. The question I get all the time, people come in and they're like, we're wondering if you treat do you treat the underarms? It's like, of course. Do you treat the legs? Of course. Very seriously, the point is we are, professionals and we treat all areas of the body. And the proclivities of these days of, whether you're an Instagrammer or whatever you do, people are showing more and more and more skin, whether it's at
That's
the
true.
beach or online or anywhere. So the trend these days is significant hair reduction, and we'll remove it anywhere.
Wow, that is, and do you think it's more painful I know we talked about it a little bit, but I experienced the pain a little bit.
So pain is very personal and it's very cultural. Some countries, like their pain threshold, and it's really based on the country, is unbelievably high. Whereas some, people who are a little more just sensitive, it can be cultural and familial.
Right.
So needless to say, the answer to that is maybe, but as a general rule, some areas of the body are much more sensitive.
Of course.
The private parts of the body
Much more
tend
so.
to be more uncomfortable. Still
Yeah.
very tolerable. It doesn't bother us at all, but you do have to be prepared that it's going to hurt a little bit more.
And it's the same thing every 6 to 8 sessions, I mean.
You're going to need 6 to 8 sessions anywhere in the body. Again, some people more, very few do people need less. And you may need a maintenance treatment if you have a baby, if you're breastfeeding, if
right.
you are, a weightlifter. Anything that can increase or change your hormones
Yes.
can cause hair growth. So
I definitely did it wrong when I did it.
there's another analogy that I make here, which is, as we age, we get hair in places we don't want. Where do men get that hair? They get it on their ears. So you'll never see a child, you'll never see a teenager with hair on their ears, but you'll see an older man with hair in his ears. And it's not a function that the hormones changed. It's that the ears have been exposed to those hormones for decades. So there is an element to this discussion where the hair will grow over long-term androgen exposure. And that's why when you get in your 30s or 40s or even 50s, you may get new hair in places you didn't like it. And it's not that it's new, it's that it was always going to be there, but now it's thicker, darker, more dense, more visual, you can see it easier because it has changed because of the long-term hormonal exposure.
Wow, that is so.
So I have always been concerned when it comes to laser hair removal, because I'm a Black woman, that it would cause some kind of scarring or like permanent discoloration or hyperpigmentation. What kind of advances in technology have there been in laser hair removal for darker skin tones?
So let me preface this by saying laser hair removal in warmer skin tones is 100% safe, 100% effective when the correct equipment is used and when it's deployed appropriately. So the concern, to dive in again, is that we're trying to target this chromophore, this hair bulb, and it has to have melanin and it has to be dark. So as a result, it has surrounding skin that also has melanin. So how do you target that bulb, those stem cells, and not touch the surrounding skin? And the answer to that question is it's actually a very interesting word in medicine. It's a portmanteau, a selective photothermolysis. We're just trying to target those stem cells, so that's selective. And then the photothermolysis, photo is light, thermo is the light, is heat. Lysis is the Greek word for destruction. So what we're doing is we're taking light, converting it to heat, and destroying hair. And that occurs so quickly that the laser light enters the skin, fractionates and destroys that hair bulb containing the stem cells, and then it doesn't touch the surrounding melanin. So scarring is never a concern because you're
Okay,
not going to
that's
get a
good.
texture change. You could get
Oh.
a color discoloration, but only if it's done inappropriately.
Which is
So-
not happening at Laser Away.
Well, we pride ourselves. I mean, we've taken a tremendous amount of time, energy, money, emotion to provide training for our staff. And we have more experience doing this than anyone in the world. I don't know the number, but we're in the millions and millions of treatments.
Wow.
So if you look at a medical study, the N number refers to the number of patients in a study. So whatever the study is, whether it's a diabetic medication or any medication, when you look at the study, the larger the N number, the better clinical data you're going to collect because there's more people involved. So our data, it's relatively unbiased because it's coming from geographic areas all over the country and because of the sheer volume, the amount of people being treated. So Every single day we get a little bit better. We talked about technology evolving. Well, it can only evolve with the objective data. So we have access to that data because of our proprietary electronic medical records, and as a result, we can dive in and find the perfect settings for the appropriate skin type, for the individual, for the age, for everything. So it's really a secret
Wow.
asset we have that other people don't have, and including the device manufacturers and big pharma, because
Really?
they can create the devices and they can test the devices, but they can't deploy them like we can with the sheer number. So
wow.
at the risk of self-aggrandizement, we're really, really good at this.
Well, no, that made me very interested in laser away because of all of the locations that you can collect. Like I've gone to various, whether I did the laser hair removal with this group on here and this group on there, you know what I mean?
Yeah,
It's just
sure.
you want to go to the same place where they have
Continuity.
Yeah, continuity.
Yeah.
Thank
Well,
you.
especially, again, I'm going to go back and get graphic. Like, if you're going to get on your hands and knees and get treated in a very delicate area,
Sure.
you want to have some rapport with those people,
Yeah,
right? Like,
definitely.
if you want to go to Groupon, do it. But you
But-
might be a little more comfortable with a
Of
company that has a
course.
reputation. We've been around 18 years. We do this all the time.
What are the side effects of laser hair removal? I remember
Ooh,
being
good
told I
question.
had to wear sunscreen and it was kind of itchy too.
Yeah, so side effects is a great question, and with every single prescription grade treatment or medication out there, there's good side effects and there's bad side effects. So when we talk about side effects, you're really referencing the bad side effects.
Right.
And so, the good side effects are you get hair
Yeah.
reduction. The bad side effects is that comes at a cost, which is discomfort. So the number one side effect with laser hair removal is the little bit of pain that's associated with it. And again, certain parts of the body are much more uncomfortable than others. Underarm, not that uncomfortable. Legs, not that uncomfortable. Bikini area, more sensitive. The next most common is you can get some ingrown hairs, and that results in
Yeah,
itchiness.
that's what it was.
Because we're destroying that hair bulb, we're destroying those stem cells, but you're not destroying all of them every time. You're only destroying 10 to 15%.
Right.
And you can't destroy more than that because of the anagen growth. If there was a device that you could treat, people get asked this question, why can't you just do one treatment and destroy all the hair? We are destroying all the hair with one treatment, but we're destroying all the hair that's growing. We can't destroy the hair that's in the transition phase or the resting phase or the falling out phase. So we're only treating that specific subset of hair type, and that we have to destroy it every single time it's growing, and it's growing in these cycles.
Right.
So, needless to say, that you're going to get more hair regrowth, and those bulbs are going to fall out. And when they fall out, you can get a little bit of itchy, like pruritus, we call it. You can be itchy. Very tolerable. You can take some oral
Yeah.
Benadryl. You can use a mild steroid, and that will help significantly. But those aren't really side effects as they are anticipated events.
Okay.
So a little bit of discomfort, a little bit of itchiness. The hair will typically fall out within 7 days. Some people love to see that. Like, you can kind of use a washcloth and
Really?
exfoliate, and then you're like, whoa, and you see these
Wow,
hair
no.
nubs and
Yeah.
they fall right out.
So
But
cool.
it just depends on what if you want to see that. But those are the most
And you have to
typical
wear
side effects.
sunscreen
Well,
or
that's
no?
a sunscreen you should wear all the time.
Well, yeah,
anyway, I mean,
that's a given.
what-
Okay.
this is actually like a really interesting topic for me is sunscreen, which is I'm a big proponent of barrier protection, hat, glasses, long sleeves. That works the best
Yeah. 'Cause
works
I
better
swear
than
I
sunscreen.
still get burnt sometimes when I wear sunscreen.
because it can bounce up and because
Yeah.
it can come from different areas. Now, sunscreen's the next best thing you can do. And that prevents the signs of premature aging, and it can prevent skin cancer. But it can make any aesthetic treatment you're doing just go better, because if you come in sunburnt, well, you're in an inflammatory process right at that moment.
Yeah.
And each treatment, it's a snapshot in time. Like when we treat a patient, we're treating them at that moment right then. We're not treating them 20 years ago. We're not treating them in the future. So we have to treat them based on what we see right then. So we want people to come in sun protected at that time so that we can adjust our device settings appropriately.
I see.
And if you come in sunburnt, not the end of the world, but we may have to reschedule you. And then what happens? Now you're off this 4 to 6 week
And then the
schedule.
cycle.
You're not treating in the
Yeah.
antigen, you're treating in the catagen, and then you
Oof.
won't get a great result. And then you may need 2 or 3 more treatments.
More treatments. Is there a downtime associated with laser hair removal?
No, not really. I mean, the clinical outcome that we're looking for immediately following a treatment, we call it perifollicular edema, which means around each follicle, you're going to get a little bit of swelling, and you can have a little bit of erythema too. So each little hair follicle might just be a little bit irritated, but there's no other downtime. You can go right back to work or
Can I
social
wear
obligations.
deodorant? Can
Yeah.
I do all my antiperspirants and all of that?
No other
staying?
restrictions after.
No
Right.
restrictions afterwards? Okay, I was just curious.
Now we've talked about laser hair removal. What about laser tattoo removal?
That's
So-
big right now.
Yeah, you know what?
Regretting
think
those
that
college nights.
Oh, big time. I think the pendulum is swinging back because it certainly was swinging where everyone was getting a tattoo. If you go to the beach these days, I mean,
Oh,
it looks like everyone has a
everyone.
tattoo. We are seeing a ton of facial tattoos that people get on their face and they want those removed.
Oh,
What I've seen, and this is just from like TV, reality shows, when someone's getting a tattoo removed by a laser, they are acting like they are in more pain getting it removed than they were
I've
getting
heard
the
this.
tattoo.
Yeah.
I don't
Right?
want to. Let's
Is
get
it
down to
pretty
brass
painful?
tacks. It
Yeah.
hurts. So
Okay.
here's the good
Oh,
news. Laser
I
tattoo
love
removal.
honest
I
doctors. I
know.
love that.
Laser tattoo removal is extremely uncomfortable, way worse than laser hair removal, but it's very fast because
Oh.
it's dependent. Well, it's dependent on the size of the tattoo. Most tattoos are very small. The average tattoo is about 4 square inches, and think about it: 1 square inch is the size of a postage stamp.
Okay.
Okay.
7 square inches, give or take. For those of you listening, not watching, I'm shaking my hand to say approximately. Is a business card is about 7 square inches.
Oh, okay.
So the
That's a
average
good visual.
tattoo is about 4 square inches, and that's only going to take less than 60 seconds to treat.
Okay.
So it's going to be a very uncomfortable 60 seconds,
That's not bad.
but it's tolerable. Now,
Yeah.
if you have your full back, if you have
Yeah.
the barbed wire around your arm, if you have a giant lower back tattoo, well, that's going to be more uncomfortable.
Well, and like before, like you said, it depends on the area. I mean, your face
Very
and neck,
much so.
I can't even imagine, right? That would feel very uncomfortable.
You know, the
No.
irony about face and neck tattoos is that they respond extremely well because they're so vascular, number one, and number two, you have gravity on your side.
Oh, okay.
The tattoos that respond the worst are actually ankles and feet because you don't have, they're not as vascular
Oh.
and you don't have gravity on your side.
And they're so bony.
And they're so bony, so it's
Oh.
painful. So needless to say, again, I'm not here to judge, but if you have a
no,
facial
you do
tattoo,
And you want to get it removed.
and you say it's not right for you, then
anymore.
that one, the good news is that one's very fast because they have to be small.
Right.
They respond very well to
Oh,
treatment.
that's good.
What kind of lasers do you use to remove a tattoo?
So that typically for tattoos, the laser that's used is a quality switched or picosecond ND-YAG, neodymium uridium aluminum garnet laser. Back to my favorite word, selective photothermolysis, same concept. The laser light enters the skin, and keep in mind, your body is trying, when you get a tattoo, your body's trying to destroy it every single day, but the ink particles are so large that they're conglomerated in this dermal layer of the skin, so your body just kind of ignores them. And so it just sort of leaves them alone. There are inflammatory cells there, particularly when you first get the tattoo, but your body's not doing much with it. Now, why do tattoos fade over time? Because your body is sending white blood cells and occasionally breaking down that ink a little bit. And all we do is augment that process. So laser light enters the skin and it fragments these large metaphorical boulders. And these boulders, we break them down into stones. And your body washes a little bit away. And the next treatment, we break those stones down into rocks. And your body washes a little away. We break them down into pebbles, into dust, and eventually your body washes it away. So your body is doing the job. Your body is metabolizing it with white blood cells and lymphatic drainage and vascularity. But we're simply teaching your body to attack these smaller particles, and they can obviously do a much better job destroying smaller particles than larger particles.
Let's say you have light colored skin, okay? And you have a very bright tattoo. Is it harder to remove a brighter colored or I guess a multiple colored tattoo than it is on someone who has
Or does,
darker
like,
skin?
pigment
and the thing?
matter
Yeah, I
in
guess
your
that's really
Yeah.
the question. Does
Yeah.
pigment
So
play a role?
ironically, black ink can be removed from any skin type.
Oh.
When you get into the more exotic colors, you have to remember, I have no idea what was injected into you. I wasn't there. And the tattoo artist probably doesn't even know what was injected into you because they purchased the ink. So these ink colors, and you have kids, so you'll understand this. How do you make these colors? Well, primary colors are mixed together. But if you think about purple, right, it's blue and red. So this is where it gets really tricky because blue responds to one wavelength of light, which is a 694 ruby nanometer wavelength of light, and red responds to 532, which is a quality switched double neodymium aluminum garnet laser. So needless to say, purple, there's no wavelength of light that treats purple.
Because
You
it's
got to
the
treat the
two at the
blue,
same
you got to treat the
time.
red, and you can't treat them at the same time.
Right.
So sometimes you treat a tattoo and it changes colors. So the
Oh.
patient says, I came in with this purple tattoo and I'm
Now
getting
it's
treated,
blue.
and now it's now it's blue. It's like
So
because
do
we
they come
removed
back
all.
again?
Yeah.
Okay. How many
And
treatments usually does someone?
So if you're going to pitch underhand, I'm going to hit out of the park. In 2006, I co-authored the paper that's the definitive paper. It's called the Kirby Desai scale. I have
Oh, hey.
no ego, so I named it after myself. I wrote
Ooh.
it with Dr. Desai, and it's you can get it on Google. We purposely didn't put any proprietary patents or anything like that, so it's available, worldwide, and it is used
So
worldwide.
nice of you.
Thank you. To give you that's academia, medicine, right? It gives you the best means by which to predict how many treatments you need.
Okay.
Now, in interest of full transparency, it's not perfect because there's so many factors that we can't
Oh, yeah.
control.
I'm sure there's
But
variables.
the scale allots for 6 different factors,
Okay.
which is the color of ink, the location on the body, the density of the ink, if there's scarring, things like that. And you put it into this very simple formula, and then it will give you a generalized estimate of how many treatments you need.
Okay.
So to answer your question, very typically you need 5 to 15 treatments.
Okay.
That ranges unbelievably widely depending on
Yes.
everything, how long you've had it, all these other factors. So you can just Google the Kirby Desai scale,
Okay.
and many different pages will pull up, and then you can enter it in there, and it will give you an estimate. But it's not
Okay.
perfect. I want to make that very clear. It's not perfect
Sure.
because it can't be. Science isn't perfect.
So when you get a tattoo, again, I
Mm-hmm.
don't have any, but you often see people with it wrapped in like saran wrap or protected.
Yes.
After a laser tattoo removal treatment, are you having to wrap it or treat it in any kind of way
So-
so that it doesn't get infected?
This is
Right.
an excellent
Yeah.
question. So laser light is sterile, and no device comes in contact with your skin. So the chance of infection from the treatment itself is 0.
Oh.
But you can get an infection anywhere. You can touch an
Sure.
ATM machine,
Oh,
you can go to
right.
7-Eleven and touch the doorknob and get an infection, right? So you do have open skin. And so you are prone to, more than a person who's untreated to have an infection.
Okay.
But again, that's not from the process, that's from aftercare.
Oh.
So compliance is imperative with any of these treatments, and it's on us to teach aftercare. And we do a really good job, whatever the treatment is, of giving you proper aftercare instructions. So not only do we verbally tell them to you, we email them to you.
Oh.
So as soon as you go home, you have an email there, and it says, whether it's hair removal or neuromodulator, Botox, whatever it is, tattoo removal, it says, here's what you can do and what you can't do. Now, again, I'm just telling you my personal experience. Within the patient population realm, some of the least compliant patients are tattoo removal patients.
Oh.
So
I
I cannot emphasize this enough. With every medical treatment, whatever it is, even if it's elective, even if it's voluntary, even if it's as minor as someone might think of laser tattoo removal, you still have to really be compliant with that aftercare.
Okay.
And
I'm so
again,
glad
it's
you
very
stressed that.
dependent upon the size and the location. Little tiny tattoo, no big deal. Face heals really well. Ankle tattoo, if your socks are going to rub on it and you're going to run around, you're probably exposing yourself to
Yeah.
statistically more problems.
By the way, I've heard that it's very expensive, especially because you have to do multiple times. Is
So
it?
tattoo removal is relatively affordable. We charge per square inch, and
okay.
so it just depends.
Depends
I
on the
mean,
size.
and the thing is, like, again, sometimes people will come in and they have a full back tattoo. We're talking 300 square inches, and that's going to be cost prohibitive. So we lower the price. But they are going to need a package, which is a great segue to CareCredit.
CareCredit, credit
So
card.
with tattoo removal, you're going to need multiple treatments. There is no one in the world who's going to have one treatment and remove the tattoo. And so again, we want to fulfill your cosmetic goals. If it's to fade the tattoo, you're going to need multiple treatments because some people want to cover it up or correct it. If it's to remove it, you're going to need more treatments. Again, you can use the Kirby Desai scale. I'm not trying to get a plug. I don't get a penny out of that. But ultimately, you are going to need multiple treatments.
Okay.
And so we want you to achieve that goal. And the best way to achieve it is to purchase a package. And purchasing that package does make the overall one-day expenditure more, but it saves you money in the long run.
Yeah, you're gonna get the results that you want.
And it also
Exactly.
feels like laser tattoo removal is restorative and transformative in a lot of ways.
I mean, listen, if you have your ex's name tattooed on you, it can be
Oh, jeez.
really a huge problem. And this is what I say to people. People come in, they're very embarrassed about their tattoos. And I say, listen, the person I was 10 years ago is not who I am today. The person I am today is not going to be who I am 10 years from now. We all make mistakes. Yours, although it was permanent at one point, it doesn't have to be permanent anymore. So we'll go ahead and start that process if you like, and you can kind of change this outerly expression of who you used to be.
We have reached our favorite segment,
Oh,
Ask the Expert.
yes.
Yes, so these are questions from our audience
Okay.
asking you, the
Okay.
expert. Our first question, is, can I combine different laser treatments like getting laser hair removal and a laser facial at the same time?
Yeah, absolutely. So when you're imparting laser energy into one area of the body, you do have to be careful because you don't want to overheat that skin because you can get microcrusting, redness, swelling, things like that. We do have certain combination treatments where you can use 2 different energy-based devices at the same time in the same area. But also to answer that question in a different way, many times people come in and get multiple treatments on different areas of the body. Laser hair removal in the bikini, laser tattoo removal on the lower back, Botox on the forehead, skin rejuvenation on the face. So you can do multiple treatments, but if you're going to get a significant energy-based device treatment in one area and you want to do more than one type of technology, sometimes we space those out a month.
That makes sense.
You just don't want to put too much energy into one area at one time.
That makes sense too. Dr. Kirby, what's the youngest age you would recommend someone starting laser treatments for hair removal or skin rejuvenation?
Oh, I love this. So we will treat, 18 and up is totally safe.
Okay.
Some people, puberty starts differently for boys and girls, and some people are late bloomers and they go into puberty later, and you will still grow body hair, into your 20s. Like you don't have a full mature pattern as a teenager, but some people do. So the answer is 18 and up is totally safe, but you may need additional treatments if you haven't reached hair maturity. Now, conversely, we will treat as young as 16 with parental permission and the parent in the room. And that's often young girls who went into puberty earlier and have excess hair.
Yeah.
And I tell the parent very transparently, you may need more treatments in the long run because we're fighting against these active hormones. Who has the most amount of androgen growth causing the anagen
Teenagers?
phase?
Yeah, I mean, that makes sense. Yeah.
So the hair is new and it's disturbing to them, but that hormones are lighting a fire, and I'm trying to put that fire out, but it's a big fire. So we can definitely treat that young, but they won't get as efficacious of a result as if they waited until they were 18, 20, 22.
In their 20s.
So again, anytime you're going to have a hormonal change, you may need a maintenance treatment. So a maintenance treatment might be one your hair will be thin, fine, less dense. You used to have to shave every day, every other day. Now you have to shave every 6 weeks. Well, a maintenance treatment will knock that out, and then you don't have to shave except once a year. So every once in a while someone will need a maintenance treatment, but it depends on your personal physiology and your hormonal status.
That makes sense.
Dr. Kirby, I can't believe I'm about to say this, but
Oh,
it was
here
so
we go.
exciting talking to you about laser hair removal
And tattoo
and
removal.
laser tattoo removal.
It was very
Thank you.
educational.
Dr. Kirby, we could talk to you
All
literally
day.
all day long
We gotta wrap
because
it up.
it doesn't feel well. I mean, you're giving us so much great
Well,
information.
when you guys leave, I'm just going to keep talking.
Oh, okay, we're gonna turn the lights off. He's gonna keep going.
exactly.
Okay, no, but we
We'll
are
keep the
so
cameras
glad
rolling.
that you joined us
No,
today.
The
yeah,
pleasure's
thank
all
you.
mine.
So
I love
fabulous.
to educate. Happy to be here, and
so
look forward to seeing
grateful.
you guys at Laserway.
Yeah. Oh, I'll be
Using
there.
We'll be there.
I'm
We'll
there.
be there.
Yes. Thank you.
Thank you so
Thank
much.
you, Dr. Kirby.
Appreciate it very much.
You are awesome.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.